If you're watching this, chances are you or someone you love just got some pretty stressful news about a blocked kidney, and I know that can be a lot to take in. So the whole point of this is to just walk you through it calmly so you understand what's going on and what the plan is to make things better, okay? Let's get right into it. Hearing the words blocked kidney can really throw you for a loop. It's usually something that comes out of nowhere, it feels really urgent, and naturally, that can stir up a lot of fear and questions about what's next. You're probably in a good deal of pain, feeling pretty confused, and that is completely 100% understandable. We're going to go through this together. And does any of this sound familiar? That really intense pain, maybe some fever and chills. And on top of all that, just feeling scared. It's this 1-2 punch of feeling awful physically and emotionally. And I just want you to know that's a very normal part of this whole experience. So let's talk about what's actually happening in your body. What does blocked kidney even mean? Yes, it's a serious situation, but it's also a problem that doctors have a very direct, very effective way to handle. You know, the easiest way to picture this is to think of it like a major highway. Your kidney makes urine, and it's supposed to flow down this tube, the ureter, to your bladder. That's the road. A blockage is like a sudden, massive traffic jam that shuts down every single lane. All that traffic, the urine has nowhere to go, and it just starts backing up, causing a huge problem. So, why is this such a big deal? Why the urgency? Well, that backup creates a ton of pressure inside your kidney, and that's what causes that awful pain. But even more importantly, urine that's just sitting there, trapped, can get infected really, really fast. And if it's left like that for too long, all that pressure can actually cause permanent damage to your kidney. So, number one priority, we've got to relieve that pressure now. And that brings us right to the solution. When you have a massive traffic jam, what do? You open up a new road, a detour. And that is exactly what a nephrostomy tube does for your kidney. It is, by far, the fastest and safest way to deal with this immediate problem. The goal here is actually really simple, and it's all about protection. Right now, we're not even worried about fixing what caused the blockage. The only thing that matters is creating a safe, new path for the urine to get out. This takes the pressure off almost instantly, which helps with the pain, and most importantly, it protects your kidney from getting hurt. Now, you might be wondering, are there other ways to do this? And yeah, there are. Sometimes a urologist will try to place a little tube called a stent from the inside, going up through your bladder. But if the blockage is just too tight, they can't get past it. So when that stent isn't an option, or when we just need to solve this problem right now, putting a nephrostomy tube in from the back is the most direct and reliable way to go. Okay, the word procedure can be a little intimidating. I get it. So let's pull back the curtain and look at exactly how this is done step by step. I think once you see how it works, it'll feel a lot less scary. The two big words to remember here are precise and minimally invasive. This is not some big open surgery. It's done by a specialist called an interventional radiologist, and they use live imaging, like ultrasound and X-ray, as a sort of GPS to see exactly where they're going every step of the way. It's incredibly targeted. So here's the play-by-play. First, we get you comfortable. You'll get some light sedation to help you relax, and we'll numb up the skin on your back. Then, using that imaging GPS, the doctor finds the perfect, safest path into the kidney. They'll use a tiny needle to get access, place a soft little wire, and then that flexible drainage tube just slides right over the wire into the perfect spot. That's it. We secure it to your skin and hook it up to a small drainage bag. And the best part? The whole thing is surprisingly fast. We're talking about 30 to 60 minutes from start to finish. In about an hour, that pressure is relieved and your kidney is safely draining again. All right, so the tube is in, the pressure is off. What happens now? What does life look like after the procedure? Let's talk about recovery and getting you back on your feet. The relief usually starts right away. I mean, immediately, urine starts to drain and that pressure in your kidneys starts to go down. Within just a few hours, most people say that intense pain is so much better. And in just a day or 3, you're pretty much back to your normal routine, just with a few small changes. Living with the tube just takes a little getting used to. The nurses will teach you how to do a simple dressing change and how to empty the bag. It becomes second nature pretty fast. And just to make sure it keeps working great, the tube gets swapped out for a new one every few months in a really quick and easy visit. Honestly, most people adapt very quickly and just get on with their lives. It's really helpful to think of this tube as a bridge. For a lot of people, it's temporary. It just stays in place while the doctors figure out how to fix the original blockage. For others, depending on what's causing the problem, it might be a longer-term solution. Your doctor will talk to you about what your personal roadmap looks like. And that's really the bottom line, isn't it? This procedure is a crucial first step. It stops the crisis in its tracks, it protects your kidney, and it gets you out of pain. It just buys everyone time to figure out the next steps without being in an emergency. So, I'll just leave you with this final thought. Right now, your world might feel like it's all about pain and worry, but this procedure is designed to take that away. It gives you a sense of control back. And once that pain and worry are managed, you can start to focus on what really matters, the plan for tomorrow and the path to feeling better for good.